Yeah, how common is acne?
Acne is incredibly common. The statistics would say that about 9 out of 10 teenagers will get some degree of acne. But do you know what? I think probably everybody will have a spot at some point in their lives.
Who normally gets acne?
Anyone can get acne. It's most common in teenagers and in our early 20s, so 15 to 25, but some people will still get acne into their 30s and even 40s.
Is acne infectious?
Acne is not infectious. Very severe acne is often inflamed by infection with a bug in the skin, but you can't catch acne from another person.
How many spots make acne?
Most people will get the occasional spot, and that's just a spot. I think if you've got spots all the time, then you've got acne. And depending on how many spots you've got and how severe they are, is how we would grade the acne between mild, moderate and severe.
What causes acne?
Changing hormones around the time of puberty is what tends to kick acne in, and that's because when our hormones kick in, we start to produce an oily substance in little glands below the skin called sebum, and that can make you more likely to develop acne.
How severe does my acne need to be before I can go and see a doctor?
I'm really glad you asked that, because too many people put up with acne for too long. Bottom line is, if your acne is affecting you, stopping you doing things, making you feel a bit miserable, that's bad enough and you need to go and see a GP.
Does wearing foundation make your acne worse?
If you suffer with acne, it's a good idea to avoid any oil-based or very greasy products on your skin. And it's always a good habit to get into to remove your makeup at the end of the day. But foundation in itself won't make your acne worse. I think it's a really common mistake that a lot of acne sufferers fall into, is that they think they don't need to or actually mustn't use moisturisers. In fact, some of the creams that we use can dry your skin out a little bit, and it's important that you do moisturise, but you use a water-based moisturiser, so nothing thick and greasy. But you will need to moisturise as well. You can actually go quietly and have a chat with the pharmacist, and they will advise you about the different products that would work for you.
When I go to the doctor, what would he give me and how quickly would it work for acne?
What your GP would give you will depend a little bit on how bad your acne is. Okay, we've got a lot of treatments that we can offer, from creams to tablets, and actually some treatments that can only be prescribed by a specialist. If you start a treatment, I think you've got to be prepared to give it at least 4 weeks. And maybe 6 before you start to see a difference. And I wouldn't give up until you've been using that for about 4 months. But if you're seeing no response at all after 6 weeks, I think it's perfectly reasonable to go back to your GP and tell him.
If I was to go on the pill, would it make my acne better?
Depends which pill you're talking about. Most people, when they use the word the pill, mean the combined pill. And actually there is one particular form of the combined pill which is so good at treating acne that it has a licence in its own right as an acne treatment. On the opposite side of the coin, though, is the progesterone-only pill, the mini pill. And in some people, if you are choosing that as a form of contraception, you might find that it makes your acne worse.
Do acne creams have any side effects?
All medicines can have some side effects. So if you develop symptoms soon after starting a treatment, really important that you go and tell your GP. Don't just stop a treatment without discussing it with the GP that prescribed it, but don't ignore it either.
Is it true, about the sun? The sun helps your spots?
There's been a lot of talk about sun and sunbeds and do they help spots, and it's not been proven. And one of the, we've got to be very careful, because sun damage is a really big problem. So I wouldn't, ever advocate that anyone goes on sunbeds in order to deal with their spots. All right, there are lots of things that do work, but not sunbeds.